Okay, I'm here at Sutter Roseville Rehab Institution with Dr. Besarai, asking him a few questions on narcolepsy. First question is, what is narcolepsy, Dr. Besarai?
So it's basically excessive sleep, and it's more common. Start majority of the time. Early teens in the 20s, and sometime in the older people also, like up to the 40s. So this starts people have difficulty keeping them awake during the daytime, and of course this is associated with some other issues. uh, what that means is basically, nighttime they don't have a very good sleep and they are more sleepy during the day, and most of the time is not within their control. So suddenly they will have sleep episode, and there's some of the things which are associated with this, like cataplexy. Cataplexy is basically loss of muscle control, and people have sometimes that can be triggered by some emotional response, like so you suddenly you are having some laugh and some anxiety, and you lose a control of your muscle, especially in the facial area. Then you feel tired, you have a hard time concentrating. So in general, excessive sleep is the what is called narcolepsy.
Got you. And then, what are the causes of the disorder, if any?
Oh, there's a one, a peptide is in the brain. It's called orexin. Is produced by lateral hypothalamus in that area. So that's one of the peptides which keeps you awake. So if you have a deficiency in that, then you are more prone to sleep. Unable to maintain that wakefulness. So that peptide keeps the wakefulness in all of us. So if you have a deficiency in that, but there are, most of the time people who have narcolepsy, they have other sleep disorder like a sleep apnea, maintaining the good night sleep at night time. So there are other things people should be looking into if somebody is having narcolepsy.
So, what is sleep apnea?
Sleep apnea is basically is a you have a normal anatomy. For example, you are taking a breath through your nose, and the air goes through the back of your throat, and to go into your trachea, go into the lungs. So some people they have some problem, especially at the back of the throat. And basically, sleep apnea means you don't have a normal oxygenation when you are sleeping. So your oxygen concentration is low, and then that itself can have a lot of other consequences, like the newer studies are showing, people that have a sleep apnea, they have a higher risk of stroke, cardiac problems. And of course those are the same people, they don't have a good night's sleep at night time, so then they are more tired during the day. So we have to be careful differentiating between the two. That is, narcolepsy is more of a sleep apnea related issues during the night, and you are tired and you're more sleepy during the day.
Okay. Last question is the rising costs in medications to combat the symptoms of narcolepsy with cataplexy worth buying the medications?
Worth buying, yeah, absolutely, because narcolepsy is something, of course, is a degree of, narcolepsy, and everybody is different. There's a type 1 and type 2. The one is with cataplexy, another one is without cataplexy. So The question of rising cost, that's a it all depends how bad your narcolepsy is. So as a physician, we always try to recommend that you should take the medicine, and there are modafinil, Provigil, and there's a dexedrine, amphetamine. There's a variation of that. So the one I think the Provigil has the least side effect, and that's one is more expensive, and the other ones are a little bit less expensive, and they have the side effect like they are all stimulants basically. They keep you awake. Uh, the question is if it's worth spending money. Is the point is it worth to maintain the quality of life? For example, if this narcolepsy affects mostly the young people, and think about if you are unable to maintain your job, or you're unable to perform well in the school, and if you're sleeping through your lectures and not able to perform well in the school, so that itself is a good indication that you should be pay for whatever you can pay. There's always some avenues you can ask for some help for the medication. Sometimes the pharmaceutical companies, if you write them directly, they can help with the cost. If you should, if you can prove that you don't have the money to pay for the medication, and so you try to be a little bit more resourceful. So I will definitely recommend if any person who has this kind of issue, they should have a good workup done. One of the best way to diagnose is a sleep study. And if you have the diagnosis, then do not stop the medication without consulting your physician.
Okay, thank you very much.